Hi, good morning or good afternoon or good evening, depending on what time of day you're watching this. But thank you for spending a minute and having a conversation with me, Hector Bremner, CEO of Avricore Health, about our exciting growth and development as a company with our keystone technology called Healthtab, which is revolutionizing the way that community pharmacy is able to support Canadians right now, but soon internationally, patients with chronic disease and infectious disease. I'll walk you through some slides. If you've been following us, some of this information you might have seen, some of it is new. And for those of you that have not seen our story quite yet, we're excited to share it with you. The healthcare system is going through a radical change. And if you've been watching the news, and it doesn't matter what country you're in, whether it's Canada, the United States, Britain, Europe, and across the world, healthcare has been strained in the wake of the pandemic. It was already really at a breaking point before that. However, the pandemic really amplified the challenges that we have, and that is access to regular and meaningful access to primary care. Primary care being, of course, not the stuff that is acute or an emergency, but the maintenance type of healthcare that keeps people from being in an acute or an emergency sort of situation. And so healthcare needs are changing dramatically, and therefore we're going to have to innovate. Sometimes it's got to do with technology, sometimes it has to do with policy and who's allowed to do what. And what we're seeing is a big shift in the way that chronic disease is being managed in our country here in Canada, but also globally, where the community pharmacist is starting to chip away at this big challenge that we have of this putting people in hospitals. And in this country's case, we have a nearly $70 billion direct impact every year from chronic disease in this country. That's a massive number that's putting a big strain on our healthcare resources. Over half of Canadians that are over 20 years old have a chronic disease, and a third of us have either prediabetes or diabetes. And these numbers are just getting worse. The pharmacy, as I mentioned, is meeting the day, and they did a fantastic job during the pandemic where they were the front line of care for many of us, where physicians were either working in hospital or not able to open their clinic because of the challenges and the risks associated with bringing people together at that time. And so now we're seeing the after effect of their successful foray into primary care during that period of time, and also their really successful delivery of care related to the vaccination programs. They've been able to show policymakers that, look, we've always been overtrained and underutilized. There are 10,000 pharmacies in Canada, for example, and you have pharmacists that are going to medical school, that are trained and ready to be able to deal with a lot of the near-term issues that people have. And obviously, they were allowed to do injections with related to vaccine. Why not be able to take a quick sample and find out if they have chronic disease risk or infectious disease risk? And so policies have changed dramatically over the last year, and funding is starting to come into place. And we're supporting them in going into this new direction with the support of point-of-care testing. Point-of-care testing, or this acronym of POCT that you'll see, is a really fast-growing and exciting area of healthcare technology. It's pretty broad. Point-of-care testing means that anything happens outside of a hospital or a lab. It basically means near to the patient. It's about getting a result right there with the person and getting them through a process on now, rather than the delayed impact of having to go through a more multi-visit approach, or like going to a lab. It's not to say that labs will be replaced by point-of-care testing, and it's not to say that even Healthtab is designed to replace the lab. However, studies have shown consistently that when an individual is given a requisition to go to a laboratory, the likelihood of them using it is actually quite low, shockingly low. So what happens is that people get busy, or they don't take it seriously, or the cost of taking the day off of work is just too much and people just can't afford it. And so healthcare practitioners and policymakers have all looked at this issue and said, you know, it's better to get the right information and meet the person where they're at and do something now, rather than not doing something and then it becomes a crisis later. So that's driving a really fast growing point of care testing segment. And it's expected to reach over $90 billion US at the end of this decade. And patients are here for this. Let me tell you, we all are very focused on health these days. More people than not have at least one health app. The Canadian average is about three health apps related, digital health apps on their phone. And so patients have become accustomed to being able to get information that empowers their decision making and educates them and brings them to the, as they say, the other side of the clipboard, so to speak. Healthcare was always really distant and removed. You went to the doctor's office, they listened to your chest with a stethoscope and told you you were fine. People have learned and become accustomed today to question a little bit more about what's going on in the process of getting healthcare, and they want to be more of an active participant. And digital Internet of Things certainly empowers this. And point of care testing, along with new digital health tools like we offer, is really bringing forward an exciting and empowering patient opportunity. So our focus is on becoming the world's largest and most reliable point of care testing network in community pharmacies. Because the approach to point of care testing up until recently has been using instrumentation that could have questionable results, and also the data doesn't go anywhere. So the patient has no really ability to follow up or own that information. And frankly, even the healthcare practitioner doesn't really have a great record of that information. Therefore, that information in that moment sort of dies right there. Nothing really happens and can't really be utilized, and it's not really effective. But what you see on your screen now is a schematic of what Healthtab is. It's a series of components. It includes an instrument. Obviously, it includes health data component, which is our cloud-based proprietary software. We bring these all together in the community pharmacy, where the pharmacist will, of course, sit down with the patient, begin a consultation. If the patient has not created their Healthtab account already, which they can do online, they can do it right there in store. They answer a customized health survey. They take the test, which happens in minutes. The survey and the information collected from the test in real time is merged through our software, interpreted, and then produces personalized reports which the patient receives and owns, and they have power over their data, and they get to refer back to it and see how they do over time, and also easily understand what the markers mean. There are laboratories that provide you online lab results once you've had a test conducted, but you're really spending the rest of your day Googling what these results, what these markers are, what these results means, what the reference means. There's a lot of questions that people have. And we strive rather to simplify that process and make it easy to interpret for the patient as well as the provider. The patient, of course, provides consents and agrees to terms and conditions. That information is not only shared with the provider, but can be shared with government insurers, health researchers, clinical research organizations, drug makers, and alike, who need this information to understand what's happening in treated populations, understanding what's happening in community health, and drive more of the very high demand real world evidence data that we need to make drugs and services better and safer. So we provide currently 23 biomarkers. However, there's no real cap. It's just a sort of indication of to what's relevant to the community pharmacist and what's within scope for them. They're still bound by a license, and it is not as broad as a physician's, but it's getting there. And so there are a big focus and a real need in the community pharmacy and in healthcare in general to focus on diseases like diabetes. So we offer HbA1c screening, which is a blood glucose levels. Then we also offer a cardiometabolic panel today, which is looking at heart health, which is also a big challenge in our community health, as heart disease often goes unrecognized until you have a major event. But what we're finding is that patients are responding extremely well to the consultations. After they're screened, we're finding individuals that are, it's pretty routine for us to find individuals with very high levels, which would indicate late stage disease or high risk of disease. And after a couple visits with their pharmacist and follow-up tests, you can see a clear indication of the improvement of their results and their outcomes. So patients are responding really well to it. It's been remarked to us by our key clients that when someone comes in and does their Healthtab, they bring 5 people back next time, that they are a great source of referrals. And pharmacists really value the fact that Healthtab integrates easily into the practice. It's plug and play, very simple and easy to use. We provide an online training. Of course, our partners who provide the instruments, which I'll speak more to, also can support and provide training. However, we find that with a little bit of practice, the stores adopt the technology extremely well, and we're seeing really fantastic utilization. We are currently in another growth spurt. While it says that we're at approximately 450 stores here today, I'm happy to say that we're north of 530 stores already as we speak. And we will be growing significantly in the weeks ahead as we have more demand in front of us. So we're very excited about the way that growth has been occurring. We hope to be in 1,000 stores this year, and we are working hard on that, and we are very bullish about those prospects. And then we look to the years ahead of seeing sort of a consistent trend of 100% at least year-over-year growth. But we see that, and I sort of mentioned that the airplane is being built as it's taken off already. But it's really important to understand that there's a lot of very exciting things happening in terms of policy and funding and demand all happening at once. So we see really exponential growth in the years ahead, and we're right now just in the early stages of it, and it's already been really fantastic. That's thanks in part to our partners at Abbott, who we are currently offering their instruments. We have unique distribution agreements with them. We're the only healthcare technology company that has such agreements with Abbott. And what it allows us to do is to include the instruments as a part of our Healthtab offering, as well as the tests. The difference with Healthtab to something else out there in the world is there's quite a few points. Nobody does exactly what we do. They do parts of what we do. We are the first to bring a serious level of sophistication and data connectivity and also oversight is entirely unique to us, as well as the harmonization. But we're certainly first to market with this new subscription-based fully integrated approach to point-of-care testing in pharmacy. I've mentioned a little bit about quality control, and we're the only point-of-care testing program in digital health related that is overseen by a third-party reference laboratory. We're really proud of that. We know that we're providing the highest quality program available out there. The data is harmonized. This is really critical as point-of-care testing programs, or even if you're studying data coming out of laboratories, without getting too deep into the weeds on this, is that different machines that you can test a sample on have different reference ranges. So a patient could be considered acute and in a really rough shape on one machine, but the reference range might show them, depending on how you interpret it, they might be fine on another one. This is a real challenge for data analytics because you need to understand what instrument they were tested on. And so because we're using a consistent network of instruments, it's harmonized, it's consistent, and it's clear. And so it's much more easily interpreted in terms of data analysis. We're also really proud of the fact that we've made integration easy. We allow for full API integrations. We kind of view ourselves as the telephone company, if you will, where we're not taking the very much going out of style approach of health data is trying to pretend you own the data. There's a lot of companies still sort of communicating, and they're increasingly running into challenges around this concept of ownership of data. Certainly, we're building a large data lake, but it's very important to understand that the laws throughout North America and internationally are very much about empowering the patient's ownership of that data. So we view ourselves as stewards. We want to be able to get the data from the pharmacy and the instrument with minimal human interference and therefore less mistakes, and in real time get that data to where it needs to be. And so it empowers patients. Patients, of course, are driving the bus on that. They can, of course, remove their data if they wish. But we're really big believers in a patient-driven experience because it drives more volume on the network because they are more engaged and more focused. This isn't just receiving healthcare. This is something that is personal to the individual, and it's an important part of their own personal care. So we're really proud of that, and we think the numbers reflect that our model works. We specifically also remain focused on pharmacy because it's very easy to get distracted by different ways of where our technology could be applied. But pharmacy is, a $1.6 trillion business globally. And so this is an enormous sector. It's going through, I would call, sort of an Airbnb-ification or an Uberification of its sector, where you saw transportation and hospitality dramatically changed by technology and policy change. Pharmacy is going through the same process. It's early days, but it's happening rapidly, and it's a really exciting area for investment because the pharmacy is this busy, high volume, direct to patient, only place you can walk in the door and just receive healthcare besides the emergency room. Of course, we don't want you in the emergency room. And so this is really exciting that we get to be involved in this sea change is what's happening in this very, very important sector. And as I mentioned, it's patient-centered. It's something I wanted to fall back on here because it's really critical to understand that the future of healthcare is really putting the patient at the center of the experience. And when you do that, you're obviously going to be more sustainable as a business and a service offering, but you're also doing the greatest good with what you're doing. So Shoppers Drug Mart and Loblaws is the key player that in Canada has allowed us to get to this stage, and we're really grateful and for the partnership and the alliance with them. They often, or large companies can globally have in the pharmacy sector have been criticized for not supporting innovation. We have seen them lean in entirely on this approach and being able to serve their customers better. They understand that the future of retail, brick and mortar retail, is going to be having more services on site and driving more reasons for people to come into the location. And therefore, they have been very progressive in opening up pharmacy walk-in clinics, where these are like a walk-in clinic you'd be familiar with a physician, but it's led by pharmacists. So not the same scope of practice, but it is the essentials and it's what you need. And so in Ontario, Canada's most populous province, they had been given the scope of practice expansion on January 1st of this year. And so far, patients have embraced it extremely well. So you can go in there for everything from like a rash to a sprained ankle to pink eye or whatever. And they have also been really receptive to the idea of getting chronic disease screening and management and support from their pharmacist, which is not something necessarily that the physician has a lot of time for. And so this is a great stopgap in between those meetings, visits with your physician, that you have this sort of ongoing care going on at the pharmacy level. So big thanks to Loblaws and Shoppers for pushing through on this and making this a reality. And of course, we made the decision after we launched a pilot with them through the pandemic. The program, even though it was the middle of the pandemic, was a wild success where we saw 80% of patients learn something new about their health. But they, across the initial 50 stores, we conducted about 16,000 tests on around 7,000 patients. And of those patients, about 30% received a dosage adjustment, which is very interesting information as it goes to show the power of using data and simple consultation with your pharmacist and better outcomes for patients. But 30% also received a new chronic medication. This is really profound, not only from the business case of the pharmacy. Obviously, earning new customers is great. Obviously, drug makers are interested in that as well. But it's really important to know with that 30% number is that you've got patients walking around out there with late stage disease or serious illness, and they're not getting served. And so healthcare, as we know, is expensive to deliver, but there's actually an overserved population that drives a lot of that cost, and that leaves another large population out there that don't access care at all, really. So this is really exciting because we now have this ability to engage with those individuals in a low impact way. It's very simple, it's very easy, it's very quick, and they feel like they're in the driver's seat and they're getting meaningful care and better outcomes. Including the individuals in this pilot, we found about 250 people that were undiagnosed diabetics, which is pretty shocking. But there is quite a few people out there that are walking around every day with late stage disease. and are unmanaged or even undiagnosed. As I mentioned, the pharmacy walk-in clinic is a major innovation as to the way healthcare and a place where healthcare can be delivered, and we're really proud that Healthtab has been a key aspect of that. And to build on that, there's a pilot going on in Nova Scotia at the moment, and that is being watched very closely by governments across the world. Really is. It is a program where it's fully funded by the government to drive primary care in the community pharmacy. It's really being viewed as the future of what pharmacy is, and it's not a far off future. It's that program is expected to conclude by summer of next year. But I will say that it's already expanding. So it seems like the data and the results are so overwhelmingly positive. Basically, we're going to see an aggressive expansion of that program, and so this leaves a lot of reason for us to be bullish around the demand and the future, not only for our systems to be installed in stores, but also the demand on how much testing and how much volume on each location, how much testing volume each location will do. So we're continuing to expand in Canada. We're obviously driving new markets beyond Canada. Healthtab is a global platform, and we're really excited about developments on that front. We're always working to drive volume, so you're going to see more marketing communications, different approaches driven by the pharmacy, where they are going to be really driving people towards this in-store. And also aligning on more partnerships, more data connectivities, new APIs, which is the bridges that are built between softwares. And this means that Healthtab is quickly going to become the nucleus for health data we see in community pharmacy globally. So you can see our most recent audited statements that came out not long ago. Last year, we did just about 1.8 million in revenue. We anticipate this year to do significantly more than that, as we did that 1.8 on a fraction of the stores that are compared to this fraction of the stores that are operating today. And we also see not only more locations, of course, drive earnings, but again, volume per location drives earnings. So we provide on our investor deck on our website at avricore.com. You can go there and download this, and you can see there we have some projections with some sensitivities, and I think you will be excited even by our low end. But we provide the sensitivities. We have a complex model that we use to project revenues and growth, and we see a very bright future for what we're doing, and we're very confident in our approach. So with that, I'll just say that despite what's going on in markets and despite what's going on in economies and global affairs, it's very important to stress that healthcare and healthcare technology is insulated from much of this. It is essentially recession-proof. Healthcare is going to have spending growth no matter what. Point of care testing is one of the hottest and exciting areas of healthcare technology today. And the second one, or you can decide which one is going to be first and second, but health data is also really critical. We're bringing both of these two things together in the community pharmacy, which is going through this exciting change. And the pharmacy is going from being a place simply where pills are distributed to a place where people are getting hands-on healthcare, and it is going to be a night and day difference as to what your experience is going to be, and it's happening now. And so you're seeing major investments by every major pharmacy group on the planet in this regard. And we see tools like ourselves, and we're certainly proving it out, that tools like ours, Healthtab, is facilitating this critical change. So we hope that people will be excited by our story. We encourage people to keep watching what we're doing. We think that we have a lot of exciting growth throughout the balance of this year and into next year. And we are a strong, stable grower that is something you can be able to rely on and in the years ahead. So thank you for your time. And of course, you can always reach out to me. My contact information is available on the website. Thanks again. Take care.